plants are highly prone to tumors. The reason why,
Really?
yeah, it's true. Largest clinical trial in veterinary cancer history of a treatment.
That is awesome. I just learned something new. That is so cool.
There you go. Yes, it's more you study nature, the more you have to be in awe of it, really.
I am so honored to have as my guest today, Dr. Steve Marsden. Some of you may know him from some previous interviews. He's also pretty popular on social media with his Ask Dr. Steve group. He's brilliant. He's brilliant in a lot of ways, but he is a traditional Chinese veterinary medicine veterinary practitioner, and is also like a brilliant herbalist. So Chinese herbs. Do you do American herbs too, Steve?
Sometimes. I found that I could do more with Chinese herbs. It's just more nuanced. Yeah, I agree. So I use both, but I definitely go more for the TCVM. We want to talk about cancer from a TCVM perspective, which is traditional Chinese veterinary medicine, because we do look at it differently from how traditional veterinarians look at it. And I think when we're treating it, or trying to slow it down or whatever it is, because I don't know that we ever cure cancer, we also look at it differently in what we're trying to accomplish. And I think we definitely look at it more from a whole body perspective than let's attack this lump that is sitting in the kidney. Okay, for us, it's more of a whole body perspective. So can you give me a couple of examples of imbalances that might lead to cancers? Like what is a tumor from a TCVM perspective or a cancer? Right. Well, they, in some cases, they took the appearance of tumors very kind of literally. So if you were to see a tumor in a liver and it looked all kind of like the liver's enlarged and, it looks very congested and dark purple, then Chinese medicine would say, oh, you have blood stasis in the liver. And they would treat you with liver blood moving herbs in order to get you better. And so that might seem very simplistic, except when we analyze those herbs, like, well, how do these things work? We see that they work in a variety of different ways, all hindering tumors. So tumors, they like to pirate the blood supply. They like to kind of gather it and gather all the nutrients and stuff that goes with it. There are compounds called endothelial growth factors that they use to grow the blood supply to them so that they can become much larger. When we look at blood-moving herbs and say, well, how's this working? We see that, for example, one of the things that happens is those plants inhibit that compound, that VEGF compound, so the tumor can no longer grow the blood supply to it. So that's an example of how they could take a relatively WYSIWYG, what you see is what you get, childlike view of a tumor, but they end up being successful because of how those plants actually work. And if there's anything in the world that's prone to cancer, it's plants. You might not appreciate that from walking through your backyard, but plants are highly prone to tumors. The reason why—
Really?
Yeah, it's true. The reason why is they are, first of all, they have to, in a temperate zone, they have to get a lot of growing done very quickly. And that high rate of cell reproduction, you're bound to make some mistakes and end up forming a tumor. The second reason why they're prone is because they generate oxygen, and oxygen is a free radical, and is the main cause of tumors ultimately is oxidative stress and damage to the DNA. So that's why we get so many benefits, anti-cancer benefits from plants. It's no accident. The compounds are in there because the plant gets cancer too.
and it's using these compounds to treat its own tumors, which otherwise would abound. So the strategy that plants have then is probably the world's best tested chemotherapy protocol, right? Because every plant out there is using it, and you almost never see a plant with a tumor. So this, so this idea of like, let's bombard the body with like massive doses of individual chemicals, surely that is the way to treat cancer. It's obviously not, because the most successful way is using maybe 50, 60 compounds at a time, little dabs of each, and they kind of just gang up on a tumor, and, you know, it's a death by 1,000 cuts kind of scenario. Yeah.
That is awesome. I just learned something new. That is so cool.
There you go. Yes. It's the more you study nature, the more you have to be in awe of it, really.
Exactly. So stasis or stagnation is basically where we have this congealing lump. So what happens, give us an explanation for something like a more diffuse cancer, like a lymphoma that might be in like the bowel wall or in the lymph nodes. How do we describe that one?
So most cases of lymphoma seem to be, they seem to come from a problem with moving yang energy around your body. So, you know, once a day, we talked about this in the last time we spoke, that you have all this yang energy in the interior, and it kind of moves out to your periphery and kind of reaches, you know, the upper and outer reaches of your body, and then it kind of goes home to roost that night. So you need this uninhibited flow of yang. When yang energy moves, it moves blood in front of it. So one of the causes of blood stasis can actually be, underlying it can be this problem with yang energy moving. But yang moves, you know, all these fluids basically in the body have this kind of centrifugal kind of motion to it, including fluid in the lymphatic system. So that's the first thing, is we have this hindering of the ability to kind of clean the pipes, as it were, and to kind of move things through. The second thing that we have is you may have noticed a lot of lymphoma dogs, they get problems from the head going on down. So to some extent, that's a little bit like if we were to get mumps or some other viral infection. It's a heat pathogen that is invading it's a lung wind heat pathogen that's invading from their perspective. And then the third thing that happens is you get this, you know, because anywhere in the body, if it's can carry useful fluid, sometimes it can carry polluted fluid. We call that dampness. And the dampness interacts with the heat. It kind of congeals into phlegm, and then we can't move it. We can't disperse the heat pathogen. We can't move the phlegm out of ourselves. And slowly there's this creep into the interior. So we use minor bupleurum is one of the most important formulas for the treatment of lymphoma, for example, because it deals with the primary problem, which is like, let's get some of that phlegm out of there and let's restore this ability to kind of push the heat pathogens back out and to kind of cool off the upper body. So that really works well. You know, if people do opt for chemotherapy for lymphoma, which I think is, you know, depending on the situation, is prudent. There are certain lymphomas that are notoriously more difficult to treat. How we keep those dogs in remission after the chemo is we use minor bupleurum, and you can have these, they can be in remission for the rest of their lives. And then we have, for some people that say, no, I don't want chemo, we have versions of minor bupleurum that actually try their best to treat lymphoma as a whole. And we have research evidence that works, clinical trials. So if I could just, you know, you asked me a question, just like,
this is awesome.
Yeah. So one of the things that's the essential distinction between Western ideas of cancer and Eastern ideas of cancer is that this so-called Xiao-Yang issue that we've just been talking about, this inability to move Yang energy around the body, that doesn't just cause lymphoma. That causes cruciate ligament tears. That causes the pain of hip dysplasia or the joint breakdown of hip dysplasia. So, if your dog has a torn cruciate and you make the choice to try to treat that, it's partially torn, you make the choice to try to not do surgery and try to heal the cruciate. If you're successful, you have taken away some of that Xiao-Yang tendency. And if you've done that, you've made your dog less prone to cancer. So finding natural ways to treat all the different manifestations of, say, Xiao-Yang disharmony or blood stasis or damp heat or whatever, finding an alternative approach that gets rid of those problems automatically means you're less prone to cancer from them. Otherwise, you can expect maybe at some point for that Xiao-Yang beast to rear its head again and to end up with a tumor. So cancer does not come out of thin air in Chinese medicine. It's not a surprise, like, oh my God, just like we feel like it's a surprise in Western medicine. Nobody saw that coming. He was healthy all his life and then suddenly. So, how often have we heard that refrain, right? But from a Chinese point of view, you can see it coming and you have opportunities to treat it even before it becomes cancer. Sometimes dogs don't even have symptoms, right? They're just, but if you feel their pulses and you feel like you go to see a Chinese medical veterinarian and they feel the pulse and then they do some acupuncture and they see the pulse change, well, then even if there's no symptom expression of the problem, you have helped to reduce the predisposition of your dog to tumors. And all these pathologies, whether it's blood stasis, whether it's Xiao-Yang disharmony, whether it's damp heat, they all very much hinge upon diet. So one of the other trials that I'm doing with Erin Banink. I don't know if you know her, but she's a integrative oncologist. We've been working on this clinical trial for years for hemangiosarcoma, and it's nearing its end, but it's probably been a 5-year project. It's the largest clinical trial in veterinary cancer history of a treatment. What Erin found out was that whether or not the herbs that we were using were going to work depended on what they were eating. And the more they ate a fresh food diet, the far more likely that the herbs were going to help. And the more that the animal's just eating kibble or canned, the far more, well, not far more likely, but it's the more questionable whether the herbs were going to be able to make up for the headwinds or face those headwinds of an unhealthy diet. So
and it's interesting because you're talking about plants and like whole plant products are going to give us so much more than a single extract of something. I mean, we see this in the cannabis and hemp industry as well, like, using an isolate versus using a full spectrum. But we see that. So my question is, so we know if they're on a kibble diet, there's no fresh food in there. The plants have been cooked and killed to death. So yes, they have more plant material in them. It's not plant material that's going to help anything. And basically all of those compounds have just been squashed. But as you're talking about that, I'm thinking about all these people because, we're definitely into raw feeding, fresh food feeding. I'm fine with gently cooked as well. But you get this whole group who wants to do the prey model raw and are like, no, our pets never need plants. They never need vegetables. And they never need fruits. And I'm like, well, where are you getting your antioxidants from? Like, I'm a huge fan of having fresh, good plant material in there. And maybe that's my TCVM training because you have to have it.
You do, especially that Xiao-Yang population of dogs. We could essentially translate that Chinese diagnosis and say that they're carb-dependent dogs. So that doesn't mean that they should be eating 50% carb diets like the typical pet food manufacturer cranks out. Then it doesn't mean that they should be sugary types of carbs. But what we do know is that those dogs' immune systems, and of course we need our immune system to fight cancer, those dogs' immune systems are dependent on soluble fiber and fermentable carbohydrates. And you can only get those from right? Fruits, vegetables, beans, for example. Sometimes if an animal's having trouble holding its weight, then they might try some cooked oats or cooked barley or something. But for the most part, as you say, I strive for food that has a lot of antioxidants, anthocyanidins, that kind of stuff in it to kind of help to inhibit tumor formation. Yeah.
Yeah.
And inflammation.
So cool.
Yeah.
So from a treatment standpoint, what are we looking for? And I love the minor buplorum. Interesting, when COVID hit, I'm on the email chain with the VBMA, which is the Veterinary Botanical Medical Association. There's some brilliant people in there who know an awful lot about herbs. So they were doing a lot of research on what we should take. And so I have my box, which is basically full of all the different herbs and teas and things that, as everybody was researching things, I was like, if anybody in this family gets sick, I get this box full of stuff. And I know I've got minor buplorum in there because It was for the phlegm and the stuff up here. Yeah. And I was like, yep, got it in the box.
Yes. Yes. It's an amazing formula. And, considering there's so few ingredients and it's 2,000 years old, it's just astonishing what that formula can treat. The guy who invented it must have been a genius. Yeah.
Well, it was some guy who's, on a mountain picking different plants and seeing what works. And, that's how all this came about. They didn't have a textbook that somebody gave them. It was, well, we'll try this. And,
he wrote the book.
So basically, when we're treating, besides we definitely need a fresh food diet, we need, complete plants, not single extracts for the most part, or we need combinations of things. So we're basically looking at sort of resolving stasis or stagnation, draining damp and cooling, draining heat.
And cooling. Yeah. So damp heat is another major tumor formation, mechanism. And damp heat essentially translates into inflammation that's arising as a result of a diet that's way too processed. So raw diets are the antidote to damp heat. Damp heat animals don't have any sort of carb dependence. So they thrive on very much smaller amounts of plant material compared to the Xiaoyang animals. As you said, some fiber in there, some antioxidants, always a good idea. But certainly those dogs need relatively little. And what those diets and the herbal formulas that treat damp heat, what they do is they essentially are antioxidant, they're anti-inflammatory, they help protect the DNA from damage, they help to stop the blood supply from rushing to the tumor site. Those are, some of the major mechanisms that they use. They basically cooling and drying and draining is how those formulas, like say 4 Marvels combination, how they work. So that would be the other big mechanism of tumor formation. So we talked about blood stasis, we talked about this Xiaoyang disharmony, and then damp heat would be the third. Yeah. And all of them have dependencies on an unhealthy diet for them to rear their ugly heads. If people are like, okay, I need a practical tip, like give me something. Just talking theoretically, there is one formula combination that I find treats a lot of different tumors. So if I can mention it, if you like.
Yeah, absolutely.
So these are all Con essential formulas. You can access those through your vet, or if you don't have a holistic vet in your camp, then if you go to Ask Dr. Steve DVM on Facebook, you'll see in the featured post there are practitioners that have offered the Ask Dr. Steve people to supply them with the herbs.
Awesome.
So one of them is called 6 Gentle Pets, which is 6 gentlemen. So that's by itself, it's a very effective formula for lung cancer. And I've seen it used with animals getting treated for lung cancer, and it has markedly increased their survival compared to just, say, chemotherapy alone, or what was expected of them.
Awesome.
The other thing that it does is it helps to inhibit cachexia. So cachexia is what takes us out with tumors. It's when you're kind of you're eating more food and you're losing weight, and at first you think, yay, at least I would.
Yeah, it's all that muscle wasting, though.
You're slowly wasting away. That formula helps to inhibit the development of cachexia. There's a lot of things in it that are kind of antidotes to that process. The second thing is a formula called dispel stasis from the palace of blood. So this is the palace of blood.
Yep.
So your lungs, your chest cavity. So pretty much any tumor in here, even metastases, will benefit from this blood dispersing effect of this herbal formula on your chest cavity. And where's the blood going to go? To the periphery. So who's on the periphery that's a tumor? Mast cell tumors, for example. So this one formula treats both pulmonary tumors and mast cell tumors. You can see why it's a favorite. And it has...
Yeah, that's the Jouet Fu Shuyu,
exactly.
Right?
And then I modify it by putting in turmeric because, there's an abundance.
We love turmeric.
We love turmeric. And then the final thing that I teamed that with to make this sort of holy trinity is harmonize the qi, minor bupleurin. Or you can use Voltrex if you have the gold standard herb line, but that's the third component. And the Voltrex from Gold Standard Herbs that you have has turmeric in it as well. So those three together, they will treat most cases of mast cell tumors. They'll treat most cases of perianal gland adenocarcinomas, and it'll inhibit the hypercalcemia associated with anal gland tumors. They'll treat most cases of pulmonary tumors, and if you have mets in there from a mammary tumor or osteosarcoma, it'll slow them down so that your animal lives longer and is much more comfortable. It'll treat thymomas. It'll treat salivary gland adenocarcinomas. It'll treat thyroid adenocarcinomas. All of those tumors we use the same collection for, in addition to a real food diet. So
that is an amazing take home right there. And so let's say someone had their pet with all those, pick one of those that you just mentioned, and they're getting chemo. Can they use those herbs along with the chemo?
Yes, and also radiation.
Like the 6 gentlemen, I feel like they have to.
Yeah, exactly, to kind of help stop them from getting too sick. The other advantage is if somebody's using radiation for, say, a salivary tumor or a anal gland tumor or something like that, the herbs in there are radiation sensitizing. So they help radiation work better on tumors than they otherwise would, because they help to disable the tumors and make them more prone to radiation sickness. Not the animal, just the tumors. Yeah.
Right. The tumor. Amazing. Wow. What a wealth of information. I knew you were the person to ask.
Thank you. Well, I'm sure you got lots of resources at your disposal, not to mention you. Right.
This is I'm working on my own dog's bladder cancer, and his cancer markers are so suppressed, and his soft tissue sarcoma on his ventral thorax has shrunken to about a quarter of the size that it was, and it's all squishy. And I'm like, that is
awesome. What are you using? What are you doing?
Everything.
And that's an important point. Is sometimes we like to be elegant, right? And we like to just use a couple of things and get great results. But cancer is like I said, it's a death by 1,000 cuts. So having a lot of things going in, the idea is that you redundantly impair tumors in a variety of different ways. And so then they basically just like freeze like a deer in the headlights.
Exactly.
They can't do anything.
Yep.
And
exactly. So he's doing great. And I'm using a bunch of different mushrooms and mushroom tinctures. Like this poor dog probably hates mushrooms at this point because he's getting so many. But I'm using turmeric and I'm using moringa. Right now I have him on stasis breaker and Wei Qi booster, but Kendra Pope and I came up with a slight tweak on that I'm going to start soon. God, what else is he on? He was low on vitamin B12 and vitamin D, which a lot of our cancer patients are. So he's on those. I'm sort of like, how many powders? He's, cranberry powder in there so he doesn't get a UTI. And it's like, how many powders can I throw in here he's a little dog. So it's just a little bit of food and all this stuff. Luckily, he's like the best eater in the world. He's
that's
all right.
Great.
But, it's really interesting because from a TCVM perspective, the way I diagnosed this dog is his tongue went dark red.
Right.
And I'm like, you got internal heat, buddy. I don't know where it is. Of course, lab work is normal with this cancer, and abdominal palpation normal, urinalysis normal. And I'm like, well, we got to go find somebody to do an ultrasound on you. And I went, kind of what I suspected. And so I just started throwing everything in the kitchen sink at it, and he's just like, cool, what are we doing today? And I just love that. And it's a cancer that sure we could do some chemo and no. So this is what I love. If I can, and I'm not about quantity. Yes, he was supposed to live to be 27. So I don't know if we're going to get there, but, he's 15 and a half, but if I can buy more really happy time, and he plays with the puppies. He's just like, yeah, whatever. Right. And that's what we want for our patients. Like, do no harm above all. Do no harm.
Well, effectively what we do in a lot of cases of cancer with herbs is we have this misguided idea that you either, the only existence is possibly, able to be thought of as a cancer-free body. Well, nobody has a cancer-free body. Everyone has some tumor cells in some stages of development in your body. So it's a myth. So therefore, the idea of treating on that basis, the only solution is complete eradication of all tumor cells, even if we almost take you with them. That's a treatment strategy that's based on a fallacy. What plants are doing and what we're doing is you're basically taking tumor cells and you're just putting them in a state of, for now, suspended animation, where they can't do anything because you've disabled so many of their different mechanisms by using whole plant extracts, like you were saying, and by using whole foods. So they stay like that for a while. Now, a couple of things will happen. Sometimes they figure you out. And they manage to evolve around whatever blocks you put in place. You might still have something else up your sleeve, but otherwise, then the cancer starts to grow again. But sometimes the tumors, you can wait them out and they just die. Everything has a lifespan, including tumor cells. Tumor cells have a longer lifespan, but still, if you can wait them out, they eventually can die. So some owners will have heard the phrase dirty margins. Like, okay, they say it's going to come back because it's got dirty margins. They didn't get it all. And for now, it looks good, but everyone's expecting to come back. That's an ideal situation for getting herbs on board, because now you have very few tumor cells. And if you get those herbal formulas in play, you can gang up on those relatively few tumor cells and you can hold them where they're at. And then they might actually die in the next year or so. So there's a lot more basis for optimism than people think.
Yeah. Like when I would do mammary, one of my early in my holistic career, like I didn't know what the heck I was doing. I had a client with about a 9-year-old dog that had a really nasty mammary tumor in the last gland. It was ugly. And I said, well, we're basically going to remove this lump. I'm not doing lymph nodes. We're not going to do all this craziness. And they were very holistic. And they said, okay, well, make a protocol for us. And I'm like, you got a lot of faith in me because I'm still a baby holistic doc. But I, reached out to some friends and read a bunch of stuff and made a protocol for that dog. And the cancer never came back, never reared its ugly head again. And the dog died of something else at age 16. And I was like, either I just got really lucky or this dog's immune system, because the people were pretty holistic anyway, was in pretty good shape. And then I had others that would come in and it's like, oh, that went south really fast. Right. There's no guarantees with anything, but I've only had one of my own dogs that I ever did chemo and never again. I shouldn't say never, because you don't know what is going to be thrown, but it was not fun.
Well, we're at the point where the median survival times of a lot of our holistic protocols meet or exceed the median survival times of the drug. So it's not as though when you use an alternative strategy, it's not really true anymore that you're settling for second best and they're going to have a comfortable life, but it's going to be shorter. That's everyone's assumption until now. But as we start to actually subject these things to clinical trials, we find, oh, actually, we're totally meeting those standards of the drugs or exceeding them for a lot less money and no side effects. So it's
Exactly.
So when you look at it that way, then it's like it's a bargain, right? It's a great
Exactly.
idea. Yeah.
Exactly. And it really is about quality of life. And if the only thing my dog has to do for me in order to keep this thing at bay is to eat his platter full of food with some tinctures and powders in there, he's like, I got it.
The only disturbing thing I would notice in animals that are sometimes treated with holistic medicine for cancer is that, what we're used to for ourselves or with conventional care or whatever is that you can expect this long, slow slide and probably a long period where you don't feel so good. What I noticed consistently with this natural approach is animals feel normal. They feel normal. They feel normal. They feel normal all the way along. And then they just drop off a cliff. It's like you used up every ounce of gas in their tank and they got nothing left and they die very precipitously. So that can be a little unnerving to people when I don't know if it's something that you've experienced.
Yeah, but you know what? If I could choose for me, and even for my pets, like give me this great quality of life. And then like I look at all my grandparents, one died in a car accident. Well, that was sudden. One had lunch, stood up and said, I don't feel so good, and dropped over. And the other two one had a kind of a short cancer, but still, 6 months of, and then the other one, it was longer and just this slow draining, awful. Yeah, I feel great. And then I think it's fine.
You'll take the poison lunch scenario.
I will. Give me the poison lunch. It was, I don't know. My grandfather, he had a long history of heart disease and heart attacks and had a couple strokes. And I mean, he was great. He was bopping around all over the place. He was at my parents' house having a sandwich. He even had a second sandwich, watching wrestling, which was his favorite thing. And he literally stood up and looked at my mom and said, I don't feel so good, and fell out. So, nothing wrong with that.
That's how I'd like to go. It's shocking for everyone who's left behind, but for you, awesome.
Yeah, like way to roll. Anyway, Steve, thank you so much. This was so educational. There was so much information in there. Like literally, I have to go back and watch it again and take notes.
Well, thank you for having me. And I mean, I already know well. I probably can't tell you very much about that you don't already know, but hopefully.
Listen, I learned something new every time I talk to one of my colleagues. So this is always awesome. And for those of you watching, we're holding his feet to the fire. He's going to make some courses for us. We might have him do one on this topic as well. Because man, there's a lot of information in there. So Steve, thank you so much. Bless you. And I wish you all the best in all of your stuff that's going on.
Yes, thank you so much.